Good afternoon, everyone. My name is Kevin Yaudes, Dr. Kevin Yaudes from McNeese State University. This year, I am the mental health content expert for the University of Louisiana system. It is my pleasure to introduce Gina Rossi today. Gina Rossi has practiced in Baton Rouge for over 35 years as a licensed clinical social worker. Many remember her monthly column for City Social magazine, Woman to Woman, educating women on various self-development topics. Gina's career began as a social worker at a mental health clinic. She was then selected to be the first director of social work at Our Lady of the Lake Psychiatric Services that was just opening. She participated in the development of this psychiatric services department that evolved to one of the largest in the state of Louisiana. Gina's interest then transitioned to opening and leading partial hospitalization programs and intensive outpatient programs. She was later recruited to the Office of Aging and Adult Services, where she led several statewide projects and grants while serving as the manager of the long-term personal care services program. Her retirement has allowed her to develop her private practice, conduct workshops, and teach as an adjunct instructor for LSU School of Social Work and supervise interns. Her work with interns led to her 2017 induction into the LSU Hall of Distinction as the LSU Alumni of Distinction for the School of Social Work. Gina's other awards include being the recipient of the 2018 Public Servant of the Year by the Governor's Office. In 2018, she was also awarded the Rosemary Award, the highest honor from the Alzheimer's Services of the Capital Area, for her contributions to develop and improve services for persons suffering from dementia and their caregivers. Gina is a sought-after speaker and is frequently invited to present on topics of mental health, communication, caregiver issues, implicit bias. Her most recent workshops, The Crisis of Family Estrangement and Its Effects on Older Adults, addresses the tragedy of this now frequent problem and its confusing and destructive effects on older adults and the obstacles it creates for siblings during the critical time of caregiving. Her signature workshop, Ageism, Call It Out, reflects on the destructive effects of ageism on persons beyond middle age. Gina has lived experience as an American-born daughter with Latino parents. Raised in a Colombian household, she has lived in South and Central America and attended high school in Cristobal, Panama. It is my pleasure to introduce Gina Rossi.
Thank you, Kevin. Boy, that's when I hear it, I'm thinking, okay, well, I guess I'm 63, so of course I'm going to have a lot of history. So as you have some of my background, I want to thank you all for inviting me today. I'd be part of your Mental Health Monday trainings, or in Spanish, as we say, Lunes de Salud Mental. So I think I was invited mainly because of my clinical experience. As a clinical social worker, I have worked in the field and worked in the field of mental health a lot. But I am also Hispanic, Latina, and we'll talk about those terms in a minute here. But I wanted to point out and to really to say to Kevin and Katie and your team, I'm honored to be a part of your putting together this package. I think that the diversity that we talk about in terms of improving it in the university systems is important, but we all know that that's hard to really put into practice and to implement and to educate. So you've, from what I've seen, I'm honored to be with the speakers that you've chosen. I did have a look at that, so I think I'm in very good company. So as a result of my background, and it's part of the reason that you invited me to talk today, fortunately or unfortunately, maybe for some of you, I'm going to talk a lot about, I'm going to interject about some of my own experiences. And I do this very easily. People ask me a lot about my history, so I'm fine to do that. I tell them that I call myself a conflicted Latina or an ambivalent Hispanic because my background is varied, but so is, you know, a lot of the Hispanics, Latinas, Latinx that you all are going to see in your work in the university system. My experience is going to be just that. It's my experience. But the world, the universe, this culture has a lot of different experiences, and this is something that we'll talk about, will be very important to you that are reaching out to students. And I'm hoping that this is your point in inviting the speakers, is to give you some tips or some cues or some education about what you can do to help the students, Hispanic students or African American students or LGBTQ students, how to help those who are participating reach out and make their experience in the university system, those students, better, so they can go on to be a part of our community. So yeah, I mean, the Hispanic culture is, it's not a monolith, and I don't pretend to have some of the, very traumatic or dramatic backgrounds that a lot of the students that come to you might have. I have been, I don't want to say victim, maybe because I have trouble saying that for myself because I've been so fortunate, but I have experienced discrimination and stereotype, and my family has even experienced violence as a result of being from South America. So, but even so, I haven't had the experience, very difficult, traumatic experience that some of our immigrant students might have had. So I hope to give you just a small window into my culture. Anyway, and also I didn't know this is Minority Mental Health Month, and maybe that's why you chose this month, but it just dawned on me. It's like, oh, this is Minority Mental Health Month. How cool is that? So here I have on the first page here, and it's not going to show all the numbers clearly because I mainly just like this picture, but while at the end of our talk, I'll give you plenty of good resources, and I really enjoy studying resources and giving out resources. And if some of you have questions, I have a lot to get through. And so I'm hoping that at the end, we'll have 10, 15 minutes, and I'd like for you to save your questions from there. Go ahead and put the questions in, but I'll probably address them near the end. And earlier I had asked Anne if she would do a poll, and I'm not expecting a lot of, explosive numbers, but just it would be interesting to know. I am interested in knowing the audience, if any of you are, Hispanic, Latino, Latinx, that you'd like to, just so we can kind of have an idea of the number. And if you speak Spanish, that's always interesting to me too. So let's go ahead and get started. I'll tell you, I'm not very good with time, so I'll slow down, I'll speed up, but no matter what, at the end of this, you'll have your handouts. Your handouts will not be the same as the presentation. The presentation is heavy with pictures and some things that I wanted you to see, but you'll get the most important information in your handouts. Today, I want to talk about some of the terminology that's used by some of the students to self-identify what that means. Also want to talk and recognize that this is, we have a huge growth going on of the Hispanic community. By the way, I will tell you that I use the terms Hispanic and Latina interchangeably for myself. And I usually say Hispanic or Latina because I'm used to filling out forms that say Hispanic, but when I'm with my friends and my family, I'm Latina. And I'm also American. There we go. That's how conflicted I am. But we're going to talk about the prevalence of mental health issues with this population, and what are some of the barriers that they face that we want to be aware of. I also want to talk about some of the common issues that affect their integration here. I want to talk about, for example, the discrimination, the racism, the microaggressions, and the implicit bias messages that they receive, and I would like for you all to be aware of. And because we don't see it, we don't feel it, and it's something that we need to be aware of when we're dealing with students. I want to talk about the role of community, and specifically your role and what it is that you can do as an ally. And then I'm going to finish up with resources, and then we'll talk about some questions. So yeah, so this is me. Just to give you background, I was born in the United States, Fort Dix, New Jersey, to be more precise. My parents were Barranquilla, Colombia, which is a coastal city on the Caribbean, known for big time partiers and a wild carnival culture. So on the Caribbean, to be precise. And then my father was he was not an American soldier. He joined the American Army, and he had a very, he had many stations overseas, many different times, and significant posts, for example, the Dominican Republic. And then when he went on to also go into, he was an instructor at School of the Americas. For those of you that don't know about the School of the Americas, I will share with you quite openly. It was in the Canal Zone. It was very, not conflict with conflictual. It is a lot of controversy about it because a lot of the Latin American soldiers from Latin America were trained there. Unfortunately, those Latin American officers went on to sometimes be engaged in torture and covert operations that were not that the United States were not very proud of. So this has been a controversial situation. They left Panama and went on to go to Fort Benning, Georgia. Those of you that follow this, because it's a very political thing, Fort Benning, Georgia, they changed the name, but it's still pretty much, training for Latin American officers. This is interesting that I didn't know the name. The new name is the Western Hemisphere Institute for Security Cooperation. But yeah, so that was, my dad was a trainer for there. And I spent my youth there in Panama with Panamanians, Pan Canal, and this culture that we know, we call ourselves Zonians. But in all that, despite Colombia, Panama, I always consider myself an American. I'm very proud of that. And my other second generation cousins that came, they consider themselves Colombian. I go back and forth, but I do discuss my roots are Colombian, but I am an American. So I want to talk about one of the things that we need to address, and that is this is a large and growing number. This is one of the largest growing numbers. Presently, we're at 62 million. We're projected to have a growth of Hispanics up to 111 by the year 2060. That's like 1.2 million for the next 40 years. So this is why it's so important for us to address this, know this culture, know their needs, and know what we can do. I found this very interesting map because you can see there the state of Louisiana has had huge growth in the Hispanic culture. Those of you that may be in outlying parts may not see it, or you might see it more there. I did, this map is not so important to see here, but I mainly wanted you to look at the numbers at the bottom. Approximately 5.13%. And I even, as I was doing some research, I broke it down. Here's overall Louisiana is 6.9%. So that's, that's not insignificant. That's certainly enough for us to want to know how we are welcoming them and how we're integrating them and inviting them into our community. These are the parishes with the highest number. Jefferson Parish, of course, always. New Orleans area, we have a lot of Hispanics. This information you can get in the census.gov library, very user-friendly, and you can find out in your own parish, what the census is like for Hispanics. I'll tell you, I did look at some in some of the different University of Louisiana areas. Parish is small, 2.9, but growing. Remember Lincoln Parish, 3.6, Natchitoches Parish, 4%, and then Calcasieu Parish and Lafourche Parish, getting up there. These are some demographics and some societal issues that is in your handout I want you to be aware of. Certainly the number growing, the 33% of US immigrants are Latinx or Hispanic. And about 16% have a bachelor's degree, but also important to know that a good number, 19%, are living in poverty. And you may see that when you have your students, if you see them struggling. This might be something that you're probably already aware of. But I thought this was a funny meme, and I hated that, it showed a blonde lady. But is it interesting? The Americans don't know exactly, do we call persons Hispanic? Well, but some people are from Hispanic, but they're not Mexican. And so that throws people off. Americans often associate Hispanic with Mexico. I will tell you, I have trouble keeping track of it too. So, and I'm not gonna explain it totally because it's so complicated, but basically, this says that Latinos are people who were born in a Latin culture. Hispanics are those who speak Spanish, but it's kind of, I couldn't even tell you what some of these flags were. I did see the Rio flag in the Latino and the French Guinea flag, but some of the other flags that are Latino and not Hispanic, I could not identify, and I tried. But you can see here, there's a lot of overlap between Latino and Hispanic. Basically, what I tell people, if you want to know, you ask the person. I looked at a census kind of interview when they were telling people who were taking the census, and it seemed to me, basically the way they asked, if you're Hispanic Latino, is if they say they're Hispanic, they're Hispanic. So that was, how they didn't say, oh, I'm Latino, I'm not Hispanic. So the most secure way, as we always do, is just ask the person how they want to be identified. Here you can see Latino associated with the geography, so it includes people from Latin America. And usually they use a term to describe the Caribbean, Central America, and South America. Me, myself, like I said, I go by either Latino or Hispanic. I'm certainly not offended by either one. But it's interesting to note too, as Latinos come into our country, how they identify. And one of the ways they mainly identify is by the country of their heritage. So they might not be comfortable with Hispanic or Latino, or certainly not American yet. So they will say, I'm Puerto Rican, or I'm Colombian, and they identify by the country of their heritage. This is important for you to know, so that when you are asking your students, where are you from? How do you identify? You will know that generally second generation persons, they identify pretty much as their country of the heritage or Hispanic or Latino. And of course that decreases as you go further down in the generations. With Americans with Hispanic ancestry, you can see that as the generations go down, the identifying themselves as Hispanic goes down. And then they start to not identify themselves as Hispanic. Second generation, like myself, 92% still identify as Hispanic, and only 8 don't identify as Hispanic. So that speaks to you of how strong and ingrained and proud of their culture that they are. In some cases, they are proud. So this is what I thought was interesting, because we know now that we all are using the term Latinx. But when we ask Latin Americans, they're not so connected to that term. We have embraced the term because we want to further educate and make it more friendlier for LGBTQ, and that's kind of why we have embraced this term. But for Latinos, not so much. It's very difficult for them to have Latinx, because it's Spanish is a gendered language, and it's awkward and it's unwieldy for a lot of people. I myself have to train myself to use the term Latinx so that it can, to welcome LGBTQ community, but it is not something that is happening so easily for Latino. And this is in 2021, the term Latino who have not heard of it, but also the ones that, and 76% had still not heard of it. And here you see in 2021, the term Hispanic is still strongly used, Latino 15%, Latinx only 4%. And that was, that's just a year ago. So this may be changing, and maybe it's incumbent upon us to help change it. But I think it should be noted that it's also controversial, and that a lot of Latinos feel like this was thrust upon them, and that it is a white person's term that was thrust into our culture without, asking them or, including them. But just for you all to know some of the political things that are going on with that term. And of course, we'll come in all colors. You remember this, this really taught people, the Latinos, and they have a joke is, you don't look Latino to me. Well, what looks Latino? We come in all colors and look many different ways. I'm going to go by this, but I want to spend more time here on this slide, because this slide is the one, and this is in your handouts. This is a slide that addresses, and if you look, the Hispanic or any racial, this light blue bar in the bar graph, it tells you really what a high rate. This, by the way, is done from the National Alliance for Hispanic Health. This is one of the resources that I will address and I'll give you. And the anxiety disorders, depressive disorders, anxiety and depression and certainly substance abuse, the Hispanic culture, the poll that was done had a very high rate for Hispanic of, culture of anxiety and depression. Now, Why this might be, we're not exactly sure, but I think it's important to remember that we still have people who are coming here under traumatic instances, traumatic and very volatile, that could, that include also having PTSD as a result of their travels and immigrating here. And that's something also always to be considering when you're addressing students and their needs. But be aware that this is a high rate. I'm giving you the treatment issues. This is in your handouts as well. Treatment issues that affect this population. Always know that most of the Latinos are getting their care for this from primary care providers. Know too that there's a shortage of bilingual or Spanish-speaking mental health professionals, and this certainly will affect the treatment that they get. And when they do get treatment, from somebody that doesn't speak Spanish, what that happens, we know that certainly causes poor communication. Latinx adolescents use antidepressants at 50% the rate of white counterparts. I'm gonna let you look at that. Take some time with that. Oops. So these were some things specifically were found from the American Psychiatric Association, and that is the low use of antidepressant medication. Hispanics, Latinos, this has been a noted characteristics, also that they have poor doctor-patient communication, as we talked about. But some of the concerns, and we'll talk about stigma here shortly, but some of the concerns were they have a fear of addictive or harmful properties of antidepressants. They're worried about taking too many pills. This is not just with Hispanics and Latinos, of course, this happens with Americans as well, but the stigma attached to it. And they come, with an additional whole set of stigma. You all know this sign, the sign that where you take your index finger and you roll it around. If this is something that Latinos use, if you want to totally obliterate anybody's credibility or what they're saying, stand behind somebody talking and go like this, do it with your finger, and that will negate anything they have to say. Latinos, Hispanics, Latinx, this is one of the biggest stigmas. Nobody wants to be thought of as crazy. Could be one of the worst things. And interesting, because in this meme, loca, meaning it's referring to a woman. And I find it interesting that George, he didn't say es loco, he didn't, talk about a male. He purposely, this meme rather purposely identifies a woman as crazy, something that women, Latinas, just one more thing that they have to fight an additional stigma. So you will also see this as death rates from suicide for Hispanic men was 4 times the rate for Hispanic women. Suicide rate is 50% less than non-Hispanic, but in 2019, it was the second leading cause of death. You will have this in your handouts, and I don't have a lot of time to go through all of this, but I want you to know that you'll have this in your handout. So let's talk about some of the things that students are facing and in classes, and we'll talk about the stigma later, but just regarding the academic issues that can cause them stress and anxiety. A lot of them they're less academically prepared. They may have fewer social skills, and they have more physical challenges. We talked about the poverty level. So things that, may not be a challenge to Americans, depending on how the Latinx person came here, will depend. They might be having a lot of physical challenges. And they might have self-doubts about their academic and motivational abilities because maybe no one in their family has gone on to this world. And they don't have an experience with this college culture. A lot of people whose parents went to college, they understand what the culture's like. They understand about sororities and class. And second generation students, or even third generation, may not be able to experience this with their parents, and their parents don't understand that. And some are still also struggling with, this is their second language. They may have, like English is my second language. Obviously, I overcame that, but they're still kind of straddling that, Spanish, English, Spanish at home, English at school and at work, and so they're trying to balance that. What are some barriers to seeking help? Well, they have lifelong cultural messages and religious upbringing, that tell them that you don't go get help because you go to the church. Well, maybe the church is not something that they feel comfortable going to, and they're struggling. We know that a lot of Latinos are Catholic, and maybe if somebody, for example, is coming out and they feel disloyal by going to get help as opposed to going to a church to deal with this. There's also lifelong familial expectations about boundaries. You don't do that. You go to the family. And some have responsibilities to the family. It's not easy to go into therapy. They may not have the money. They may not have the transportation. They might have another job to go to. These are things that we don't often think about if we're not focusing on that. I know this because I'm going to tell you a really quick story. I worked in a psychiatric hospital, and there was a Latina woman that attempted suicide. And the next morning I came in and she was wanting to leave. She was fine. Her boyfriend was broken up, but she needed to get back out there. And I was telling the staff, she needs to get out there to work. She has to feed a big family. She doesn't have the luxury of needing help. And this is a lot different than some of the Americans that we saw that were coming in and really were just needing a break from whatever their life crisis was at the time. Not that people, go into treatment really need help, but it was a big difference. So some of the other barriers, of course, language barriers, financial barriers, and access to insurance. There might be some free services, but for a lot of people, if it's not free, where do they get it? Stigma, and we address it. We have a stigma that somebody who has mental health issues, when we go like this, we make this sign, that also gives a message that this person might be dangerous. And what are we often afraid of? Often we see somebody talk themselves, or if we don't trust them, if we think if they have a mental health issue, they're dangerous, and people don't want to be associated with that. Or they think they have a lack of faith, or that this is something of demons, el diablo, that's something that creates stigma, sinful behavior, or that this is just a private issue and are not supposed to talk about it. I don't know if you can see this very clear, but I wanted to point out that the background for many people coming into to schools is they are the interpreter, and they've been the person in charge of helping their parent interpret if their parent doesn't feel that their parent can't understand this. This is a parentification. This is a very difficult place. It causes role reversal. On a personal level, I experienced this. My parents still to this day speak very poor English. I hope they don't see this, but honestly, my mother was often alone. My father was off somewhere in the military, and I became the interpreter. I was the person that interpreted documents. I did the interpreting for teachers, neighbors. That put me in a place of being an adult. And that leads to, for many people, to be, a caregiver. It puts them in a place of being accustomed to responsibility and maybe not having the luxury of being a child. So you may have students that have come from this background of, not having the chance to be a child, and by being the parent because their parent didn't speak English. This is just something I found that the place of religion during COVID. This is a text that somebody sent during COVID, that the mother reminding the person, like, look, even though it's COVID, you can participate in Catholic Mass by TV. Those of us who grew up in a Catholic household, this is a very, very, this is ingrained in us. This is something hard to pull away from. And you can imagine if you have a student who is just coming out and dealing with a lot of things, gender orientation or sexual orientation, how this can be, I'm a 63-year-old woman, and to this day, I still have my baby Jesus with me, sleeps by me. This is something that we are ingrained in our religion for us. This is not funny, but I want you to know about the child rearing that Latinos go through. This is this is supposed to indicate a Latina mother who says, "Stop exaggerating. I barely touched you." Yet there is a hand mark. Now, Latinos grow up with strong authority figures, strong child raising. I'll tell you something else. If you're a Latino, you know what this is. It's called la chancla, and this is how we were raised. Latino mothers, there's all kinds of jokes and YouTubes, and some of them are funny, but they're also not funny. They ingrain in us a very authoritarian, but also respect for parents, no talking back. We do what we're told by our parents, what we're supposed to do. But it's also, it teaches us that our parents are always in charge. And the older we get, that's hard to pull away from. Our parents are always in charge. And if not, we get what we call la chancla. There's all kinds of, you go YouTube and YouTube la chancla, and you will, some of it is funny, but child rearing needs to be addressed because we're not used to that. I mean, Americans are not used to that. And then here's some of the stereotypes that you need to know about. Relax, gringo, I'm legal, because a lot of the stereotypes that Americans have when they see Hispanics, especially a group of Hispanics, like they automatically think, that these people may not be legal. Are they immigrants? And I chose this one about Colombia because this is a destructive stereotype about Colombians. It is just related to cocaine, and this is a person that is snorting cocaine. But there are many other wonderful things about these cultures that are taken away and diminished by these kind of destructive stereotypes that our students have to put up with. Of course, this is an especially cruel one, and this is this is not even a microaggression. This is just a hostile act about telling people that they must speak English, and sometimes not recognizing the difficulty that a lot of immigrants are experiencing while they learn English, and the people that make fun of them, and the prejudices that they experience. And there's no way to go around the fact that we had an American president that called Mexicans rapist. I'm sorry, this is not a place for politics, but remember that we cannot deny that our students are experiencing this. So what you can do, boy, we know that one of the things in terms of building relationship, building bonds, is if you can speak their language. Not that everybody, obviously not everybody can speak their language, but it is so helpful when they know that there is a bicultural teacher, counselor, therapist, advisor. It is, we know too that they are more willing to open up and talk. I wanted to just address this, that in terms of faculty staff, the difference that for some people, our students, this is there's 5 to 20 students to the staff being 20, Hispanics being 5. That's a large number of that we should be aware of, that the students are not seen as many people of their culture. And when that happens, they're also probably not as likely to be able to have that connection. But we know that these teachers who are Hispanic can be role models. They're not the only role models. Obviously, white teachers doing a good job. I'm just saying that generally teachers that come from their culture can help be excellent role models for people in school and trying to do well in college. So here's what I want to talk about. I want to talk about your role as an ally, or what you can do. And so you know these situations, we've talked about the issue of poverty, the additional responsibilities a lot of students have to the rest of their family. They might be going to school and also contributing to the income and maintaining a household. So when that happens, we're charged with recognizing that these students need flexibility. There might be times that they need more time. They might be overcoming a second language barrier. This is English is a second language. That's a barrier. If they need more time, I think it's fair to request, and I think it's fair for staff to offer that as well. And also, you can be sensitive to the family and home situations, recognizing that because of this familialism, the strong family bonds, that whatever's affecting a family member is probably affecting them also. If a student who doesn't have documentation issues, but maybe their parent is an immigrant that is not American citizen, or a cousin or a friend, those issues are still affecting them as well. So, and also, of course, students have abilities. They have to be home a lot for their parents who may not be, able to manage in a world in the United States without additional help from the children. So I ask you, if you want to know what you can do, I ask you that you advocate. Sometimes we come upon a really unique and fortunate situation where we get to go to the table. We get to sit at the table where decisions are made, and we get to have some influence as instructors or professors or advisors or committee task members. And if you get there, I hope that you will do this. I hope that you will advocate for bilingual staff and additional bilingual resources. I hope that you continue to fight for and advocate for cultural competencies. So this kind of education, we can increase this education for the rest of the staff and for the students as well. I hope that you advocate for us, more monitoring of, we've all seen institutions that speak to diversity strategies and plans. Are we really monitoring them? I mean, what's happening with them? Are we getting scores? I hope that you will participate in, stepping up, saying, well, how are we doing on this? We have a plan, but where are the scores? How are we doing? I hope that you'll be alert to the microaggressions and negative stereotypes, because it would be upon you, if you're in the classroom, to speak out to that. And a student may not feel comfortable with that. They may not even recognize it, but if you're there and you recognize it, be alert to that. And then you have to call it out. We have to call it discrimination, and we have to be brave about it. And then, I hope that you're an ally. So I want to talk about some of the resources. So the National Suicide Prevention Lifeline, this has been one that's been there 24 hours all the time. And now this is a new one. 988 started this weekend. So, I've always been like a secret shopper. I call before I give information. I call and want to know, what that experience was like. I wasn't going to call this weekend when they were just coming up. I will wait a little bit, and I'm going to call after a while, because obviously they've got to work out some bugs. But they have 988 for Hispanic persons. And so this is something that's in your handout. Remember that they have 988 for Spanish speakers, and they can also chat, and they can text. And if you want to order some of these little posters or documents, I gave you here how to order them through SAMHSA. It'd be good for you to have some around in the halls, on your desk, certainly at the counseling center. That would be great, because this is for a Latino, Latinx as well. I want to go back up to, there's also, so for example, I called the National Suicide Prevention Lifeline. I was referred to 211, and I asked 211, what would you do for a Spanish speaking person? And there was a little bit of a hesitation. And they referred me to an agency here in Baton Rouge, and I called the agency and I said, what would you do for a Spanish-speaking person, and the person had to, they had to confirm with the director. I talked to the director, and she was very clear, and she said, yes, we do offer interpreters. So, and just like they do in hospitals, but sometimes it would be best to have a staff member who is Spanish speaking, as opposed to a more distant, telehealth is here to stay, and obviously that's going to happen. But still, we are still dealing with not enough bilingual speakers. This is an infographic that is available to you too, National Alliance Hispanic. So these are some specific resources for Latinx therapy, and they're very interesting. I looked them up. I particularly like the National Alliance for Hispanic Health. That was very helpful. Some of these Latinx therapy in the directories, I was going to sign. I thought, well, as long as I'm here, I'm going to go ahead and sign up because I do have private practice. And I thought, well, obviously there's a fee, so they want you to pay a fee to be into the to be in there. But they do offer free referrals for people going in there looking for therapy. The problem with some of these is that there were very few in our communities. So soon we will have interstate compacts and we'll be able to practice anywhere. But right now, it's not congruent with the person calling with their area. For example, they listed some places in California for me if I was looking for somebody. So these are some really good resources too, some little booklets. SAMHSA has, NIMH rather has these booklets. So one is Depressant. So this is a good little booklet. If you were to order it, you could have it, or at least it's online for any students who want. There's also one for psychology, psychiatry, very good all in Spanish. And then Mental Health America has some really great, I was very impressed with this. These are all the topics that they offer. Adapting to trauma, getting support, how to get help. All of these relate to that. And also substance abuse. So these were some really great ones. And here you'll see the source, how to go to that. I'll tell you, I looked up University of Louisiana Lafayette because I wanted to see their diversity plan. As long as I was done. Here you see the Hispanic, the darker where the star is, and that's. I was very impressed with the plan. I did look at it, and then I wanted to look for actual numbers, actual, what had become this plan, because this plan was from 2019, and there was supposed to be a yearly key indicators score, and I couldn't find any. I'm hoping that I can find some later, but if anybody here, if you're aware of this, please email me. I'm interested because I'm gonna keep doing this little talk here. But it's also interesting that it's not easily available, and something for us to know. This is what we're talking about. We want to make sure that diversity and things that are focusing on multiracial, Hispanic, are really something we're taking seriously. So here's a small way you can participate. This is a theme for Hispanic Heritage Month. I know it's small, it's kind of, but this is one way you can show yourself as being an ally by encouraging this, multiculturalism and talking about it and saying, and being a part of any kind of venue or celebration of Hispanic heritage. It's a very easy thing to do. And again, if you're at the table and you get a chance to influence this, I hope that you do that. It's small in some places, but it's a way for us. It is a way for Hispanic, Latino, Latinx students to know that the community is encouraging them to celebrate their heritage. Okay, these are some really interesting sites, and I like these. Some of these are political, and some of these are just pop culture things, but they're fun and they're good to know about the background of and some of these are activists. I'll tell you, Mi Gente was something I fell across last year, and they also have some cultural things on YouTube. They're a political organization. Hip Latino is good, but NBC News it's totally devoted to, a whole section of news related to Latino issues. This is one of their articles, the pandemic set back big Latino gains from education and how to get them back on track. Some things for us to be up to date with and know. You guys, this is how you can reach me. My Gmail, I'm on LinkedIn. I do individual family group therapy. I'm a supervisor. I enjoy doing educational workshops. Ageism is my thing. I really do enjoy that, education for ageism. And now I'm going to include this because I've done a lot of the reading, and I'm going to include this as something that I'd like to do more with. I also do, my background, as Kevin said, is with the aging. I do work with caregiver issues, family issues regarding caregiving, and some of the crises that come up with that. This is especially linked to the Latino culture because Latinos, one of the things that we know is that they take care of their older adults. This is not an issue. You rarely see somebody in the Latino culture putting an older family member in a nursing home. And not that that's bad. I mean, caregiving is a difficult thing, and I never talk bad or negate how difficult it is. I also, this is interesting too, but I have done a lot of research, and I'm attending higher levels of training on estrangement. This is a new thing that's come around, is family members who are estranged from each other, especially from their parents, because they feel like maybe their upbringing was not an upbringing that helped them self-actualize. And one of the differences I see, and when we talk about, for example, the child rearing methods, and this is just my view, but I rarely see family members in the Hispanic culture estranged from their parents. It's not something that happens as much as it is happening right now in our culture. This is a crisis, this family estrangement, and it's not something you see so much. And not that there aren't cases, and certainly deserved cases, that they need to be separated. So we've got some time now for, I'm going to do a stop share here. We have some time for some questions. I'll see that there's some chat stuff here. Okay. Okay, so yeah, so here is the handout. So we have some time for chat or questions or discussions. About another 10 minutes. Tell me what your thoughts are.
Gina, I've got a question while we're waiting to see what pops up in chat. So as a faculty member at McNeese State University, one of the 9 universities in the UL system, we've had a couple open positions in the Department of Psychology and Counseling, and I've found it difficult to know where to go specifically to recruit faculty of color. There was one website that I was getting information through email about on a regular basis, but I couldn't tell if it was legitimate or not. And so we did our best, but are there resources out there that would help us look for qualified people of color to be faculty members?
So I know with the Hispanic community, a lot of times I will direct people to the local churches, because not for the church necessarily, but because they can tell you what other associations are out there, and they can tell you what other organizations. I do know that in New Orleans, there's a growing, because of the growing population, there are more and more associations of professionals, of persons who are now educated and trained and able to teach, probably. But also, one of the things that I would like to research in some of the sites, for example, in Indeed, is there a specific site where they might place something that says, this is a section regarding Spanish-speaking, bilingual persons looking for work. I had started to do this when I worked for the state because I wanted to find direct care workers who were Spanish-speaking so that we could train them, grant and train them for adults. A lot of professionals, or not professionals, people who are working need to go out and work, and they don't want to leave their family member, but they don't necessarily want to leave them. I also don't want to leave with a family member who doesn't speak English, and so that means that that person can't go on and make a good living. So they quit their job. This has a whole domino effect. They quit their job. It means they stop having money. They stop having a retirement plan to stay with an older adult because they can't find someone that has the same language as their mother, for example. This is this is something I'm I personally am very interested in because I have parents that don't speak good English. And if I were, want to keep working and I wanted to get help for them, where would I go for them? But in your situation, I think that we need to do a better job within our own practices. For example, social workers, psychologists, counselors, of helping them get together so that when something goes out, word needs to get out, boom, we can just, we can say, hey, the Latinx community that's associated with the Social Workers Association here, you guys, we have an opportunity. They're looking for an instructor, a professor, and the same with for example, the Psychology Association. We have to do better at that.
I agree. As a counselor, I agree with you 100% on that. We do have a question from Katie in the chat. What can faculty and staff do to ensure that we're working to connect students with safe resources? I'm specifically thinking about students and or family members of students that may be hesitant to get interventions because of immigration status, if that's an issue. I had a student that was legally here, but her family wasn't necessarily.
Well, I think that one of the things that we need, this is information we need to get the word out, is that when you come to me, your situation with, for example, certainly if you're a counselor, everybody knows it's a counselor or social worker, this is, confidential and we would never give this out. But professors, instructors can say, when you come to me, I will not disclose this. I'm going to be working with you and I want that. And I want you have to say it first. You cannot wait for a student who is worried, nervous to say, I'm worried, I need help, but I have a mother or an uncle living with us who is not documented, and I'm worried about them. You have to put it in a safe place out there for them so that they can go to it. You lay it out for them. During the disasters, I always go to assist at the Red Cross because I speak Spanish. And now my boyfriend, he's from Argentina, he speaks Spanish, and now I grab him and we immediately go to any kind of help sites because I know that there's not going to be enough people who speak Spanish. And I know that a lot of people who might be there who are in need are afraid to ask. And this is proven. During the 2016 floods here in Baton Rouge, we immediately went to the Red Cross site. I'm trained. This is kind of a funny little secret, but I'll tell you, I don't get in trouble with this. But I told my boyfriend, I said, listen, one of those journalists, those kind of beige journalist jackets with no arms with a zipper, and you're going to wear that. You're going to wear a name tag, and you're going to carry a clipboard, and they're going to let you go right in. So let's not be slowed down by, you have to have this training. No, you just come with me. We act like we know what we're doing, and we're going to go there, and we're going to start helping. And that's what we did. And what we found were people who were not documented, who were hungry. They didn't know where to go for food until they said, we were sitting here, and they were literally in the corner in the back watching to see where a line might form. And when they saw a line form, they realized that's the line for food, okay. But they did not want to bring attention to this. This was heartbreaking to me. They didn't want to bring attention to themselves. I will also tell you this. In the mornings, they were not there. They came in the evenings. But you know what? In the mornings, they were out there looking for work. Okay. I'll tell you, they were not sitting there on a cot waiting to be served, asking for a handout. They immediately went to work. And so I would, I'd go in the morning and I'd have to wait till the evening to catch up with them and to get them services. It was a good way. And there were some people there that were, that had an ankle bracelet. And I did watch, I guess a state trooper walk up to that lady and say, what is the ankle bracelet for? And I went there because I wanted to know what was going to happen with this and what I could do to help. And she was very nervous. And from what I remember is that she said that she had come here and they had put the ankle bracelet on her. And he didn't do anything. He didn't arrest her. He didn't do anything. He just wanted to know what it was for. So, and it's been said they will make the announcement that they are not going to take any action in a disaster like that. They're not going to take any action on somebody who is there undocumented. This is a place for humanity to help.
Gina, I thank you. I wish we had some more time for questions. We are running out of time and I want to respect everyone's time. So really appreciate you joining us for our webinar series. And I know that we will continue the conversation. Thank you.
Thank you for inviting me.